Thank you very much to the panelists. Would like to welcome and thank Senator Jackson for joining us. Senator Hannah Beth Jackson is chair of the Legislative Women's Caucus, and hope that you'll at some point just talk a little bit about the policy pillars that the Women's Caucus is championing this year, because I think it mirrors clearly the work of the Select Committee. Questions of committee members? Senator Liu.
Maybe just some comments. I mean, we have heard this time and time again. So what is it that we as policymakers are not doing to correct the situation? I mean, beyond money, what you described with Christina, she met a barrier with a community college person who said she wasn't qualified because she was taking basic skills classes as opposed to regular classes. So what is it?
It was her county worker who actually said that. The community college was very supportive.
Okay, but she didn't go on to be a nurse in the program?
She actually continued in the program and took a sanction, which further reduced her family's aid. She felt that becoming a licensed nurse would be for the betterment of her family in the long run, and that she and her daughter would simply have to make do until she reached that goal. So she is under sanction. We did work for a time to get her out of sanction and to get that benefit level back up to an amount that still wasn't enough to fully meet the needs of her family, but it was something more, but she still struggles.
Well, so the sanction, then that's the rule, right? So why don't we correct those barriers? Mm-hmm. I mean, that seems logical enough, doesn't it? And I was interested more in, Michelle, when you talked about the English war on poverty that was successful, relatively successful. And I'd like to learn more about what happened and how they did it, and how they increased resources and what they, I mean, it's more than just money. It's attitude, it's all kinds of things, people's perception of poor people. But the problem is that we have many poor people, growing number of poor people. I mean, I just was in appropriations earlier today. We have 269,000 homeless kids in California. How did we get here? So, it's a huge growing problem. And unless we change the system or remove the barriers, and we have to increase the cost. I mean, we have to talk about early learning at an earlier age as opposed to just increasing slots. I mean, it has to affect all of us. I mean, I don't quite understand. I mean, I've been sitting here for a long time. And it's very, if we just talk about money, it's really hard. But if we try to change the conversation about how we address the problem, maybe we can look at it another way.
Well, Senator Jackson has queued up her mic, but what I would say is, what struck me was the first witness who talked about it requires sustained efforts, and then hearing about the Great Britain example that they made it a priority, funded it, and maintained the funding during their recession. I think the challenge in California is we have peaks and valleys. In good times, when folks get sick of hearing us talking about it, they fund it. And when the going gets tough in terms of the overall state's economy, these are the first programs to be cut. And so we can't have sustained improvement and meet Great Britain's number of reducing child poverty by 1.8 million kids if we have this peaks and valleys process. So it's sustained effort. And I think on the worker issue, it's the issue of her first worker told her that was okay. And so it's making sure that policies that are adhered to across the level, across counties, and so folks on CalWorks get a consistent message.
Right.
And for her to have to make the decision, because she knew better for herself, which was logical, and then to be sanctioned and considered as if she's not participating in an education program, which is what the Federal Act asked of all of us in 1996, is unfortunate. It's amazing to me also that in 1996, the United States took this real huge step backwards in supporting poor families, and 3 years later, Great Britain took a very different step in terms of the culture and understanding and making a commitment to your entire population.
Well, I also think that this is the time where we cannot afford not to do this. I mean, it's just because the gap continues and it's getting larger.
Exactly. Senator Jackson.
Yeah, I agree. I mean, it is the first thing to go. Poor people, the messages are expendable. I just wonder, though, as another way to perhaps create some incentives is to require that the people who are working with these folks on CalWorks have kind of success-based criteria. In other words, their success, their potential raises, their productivity will be based on the number of constituents or clients they're able to place. Because what happens is people get discouraged or they get tired or they feel overworked. And the easiest answer you can give somebody is no. I mean, it's a very simple, as a recovering lawyer, I can tell you when you have a client and they want advice, the easiest thing to say is you can't do that, rather than say, yes, you can, and here's how to go about it. So I wonder if maybe as we evaluate how our social workers who come into their work with great enthusiasm and optimism and get beaten down by the system, if we could sort of redefine what success is and make success in terms of the number of people that get placed, that get into these jobs. So if somebody said no, and you have someone who relied upon that information, instead of saying, well, you can't do it, say, we're going to find a way so you can. And I think that just changes the whole way we attack the problem, so that we realize that we can get to yes and we can get to success rather than just throw up our hands. And we know when the economy starts going south again, that we know who's going to get hit first. But even with that, if we still recognize that if we set some standards and some criteria and some, set that bar at a certain level and say to both the clients and the workers, this is how we get, this is success, and work together getting there, I think we'll see a lot more of it. And so I just think maybe a change in approach might also be helpful. Absolutely.
Senator McGuire.
No, thank you so much. And Chairwoman, thank you so much for allowing me to be here, and honored to be here with the senators as well. And I'm going to go back to what the Chairwoman I have heard say in the past, and paraphrasing, that it's actually about making this a priority. There's a lot of folks, right? We all talk about breaking the cycle. But where it seems to stop is when it actually comes to funding those initiatives that will break the cycle of poverty. And it does have a cost. But if we take a look at what it's costing families and costing the state for multiple generations of poverty, it's tremendous. And frankly, being able to prioritize the needs between the Senate and the Assembly when you do have that executive branch is also going to be critical. So whether it is the Earned Income Tax Credit, which the Chairwoman has championed and probably our #1 tool, along with advancing that minimum wage, is going to be absolutely critical to success. But I think that if we are not unified as a legislative branch, it's going to be challenging. I think that is laying those out early, which you have done, is going to be actually critical to success. I just wanted to see if you had any comments on that.
Just that, I agree with you that as we talk about, there are any number of issues leaders in the state, the leader of our House, that the governor have taken in terms of really, really tough policy issues, global warming, how we're going to reduce, our carbon footprint, and critical issues that are major stretch goals. Great Britain is a perfect example. Our own federal government is a perfect example in terms of the statistics that were shared with us, that when there is a sustained effort, not this peaks and valleys, and a commitment that you can do it over time and make a significant difference. So I think that we have to work on ourselves to get there. I'm going to run and go take up my bill and approach. So I'm going to hand the gavel to Senator Liu. Before I leave, I would ask, I challenged you at the beginning after your presentation, where you laid out really, quite frankly, many of the policies that the other two panelists talked about as being critical also. And the question I posed was how much and how do we pay for it? I know that that's not really in your lane, your job. I'm clear, that's our lane. I'm clear what our work is versus your work, but we would like to hear from your perspective, from the Center on Budget and Policy Priorities, how that can be done. Because I'm really intrigued by the Great Britain model, particularly how they were able and made the commitment to sustain it during the recession. I think that's the piece, the new piece, that we need to begin to have the conversation about. And so if you could talk about that for me, please.
I think really to have a significant impact on poverty, I think we have to take a close look at our tax system and look at ways to strengthen our tax system so it produces sufficient revenues to fund the types of strategies that we're talking about today and the investments that we need to ensure that we have a strong economy in the future. I don't think we have the answer at this time, but it's certainly something we'll be looking at, and it looks like tax policy will be a key debate over the next year or so, and so I think that's critical to the conversation that we're having here. In the short term, there are ways to tailor policies so that they have less of an impact on the budget or on revenues. An earned income tax credit, for example, could be tailored in a way so that it gradually ramps up over time. You can
Right.
phase in the credit over time, or you can target it to specific groups of workers over time. You can just target it to the lowest income workers. So that's one way to start working towards pulling people out of poverty without having as big an impact on the budget or state revenues.
Right, I would agree with you. So talk to me a little bit more about the English exam. What did they do?
Yeah, so as we've talked about a little bit, I think one of the critical pieces was really making that goal, stating out a goal of, and their goal was to eliminate child poverty over 20 years, to reduce it in half over 10 years. They made that really stated commitment. And then, had a process of measuring that as they were moving forward. In terms of what their actual strategy was, they had really a three-pronged strategy, one of which was really focused on improving employment. So different strategies to both enable families to work, parents to work, especially single parents, and then also tax reductions, tax credits, both on the employer side and the employee side. And then increasing incomes among families with children, regardless of parental employment. So they have a universal child benefit that every child in the country is eligible for, as well as some additional means-tested supports for low-income families. And then they had a variety of strategies to reduce the intergenerational transmission of poverty by investing in early learning programs, investing in improving the K-12 education system. So I think it's these strategies, none of which are new. That's the thing. It's not brand new, innovative things. What's innovative is that we need to find the political will to actually make those investments and hold ourselves to it. So I think that we know what's been effective both in the US and in other places, and it's building that political will to make it happen.
I would agree. And so, go ahead.
What you're saying and things that we've been talking about, I think it sounds like there was just literally a commitment to do it. I'm thinking back in the 60s, there was a guy named Lyndon Johnson who talked about the war on poverty. Nobody talks about that now except to say poor people are, it's their own fault. I mean, that's the political discussion, which is sort of incredulous creating. But so if we were to start thinking about some of these tax credits, and I'm not sure, are these tax credits like for employers or employees? Because I know a lot of people in poverty don't pay a lot in taxes, which the rich people complain about, but as I tell them, well, you're the ones with all the money. That's why you pay the taxes. But, I mean, we're trying to figure out how to create some of the momentum here for a system, because there's nothing that you mentioned that was anything new that we haven't heard. It's just that they're, as you say, they're putting it all together and determined to achieve it. So, we landed a man on the moon in 10 years without even an idea of how to do it when we first started. I think we can figure this one out. It's just, how would you, I guess it's really our problem, how do we go about doing this? But are there any measurements, are there any performance? I was thinking, as I was talking earlier, this is really kind of performance-based or result-based programs. We want to see the numbers, and I think probably from a political perspective, If we can show numbers of how people are advancing out of poverty, it will generate a sort of a belief that we can do it. I think at this point in time, a lot of people think poverty is inevitable. And frankly, with a lot of the policies in place today, it is inevitable as we keep the lowest earning workers at the lowest paid numbers, and we reduce, the responsibilities of corporations and 1% to pay their fair share of taxes, although they'd argue they do, but arguably they're getting a lot richer and everybody else is getting poorer. I mean, is there some way we can measure this, that it's going to help make a difference in creating that political will?
So I think Alyssa went through a few of the statistics about what we already know about the effectiveness of our social safety net programs here in California and in the U.S., that we can, with the supplemental poverty measure, actually identify the number of children and families that are lifted out of poverty. And then I would just mention that the Children's Defense Fund's report that came out in January, Ending Child Poverty Now, actually uses a model working with the Urban Institute to look at if we invested more money in existing programs, so improving the earned income tax credit, raising the minimum wage, funding child care subsidies, funding investments in affordable housing, that we could reduce child poverty by 60%. So there are some of those numbers there, and happy to share that with you and figure out how we can use that to, I think, mobilize and build that momentum, which I think is really important.
Okay, thank you very much, ladies. Thank you. We have another panel coming up, targeted investments to reduce poverty. And we have Judy Jackson, advocate for seniors. Thank you. And Kathy Senderling McDonald, Dennis Nieringer, and Jessica Bartholow.
Madam Chair, in response to Senator Mitchell's request to reference the program that we're doing, the Women's Caucus Initiative, would this be a good time before this panel, or would you rather I wait?
Well, it's okay. We know that's kind of responsive to the first panel. So
Well, sure. Briefly. There are four pillars to our effort, and perhaps those of you who just spoke could give us your input on this when you have a moment. There are four pillars to the building a stronger California by empowering women and creating greater job and economic success for women. And the four pillars are equal pay, improving pay for women doing substantially similar work. And the second pillar is childcare and early childhood education, making it more accessible and affordable. The third, which I heard you mentioning, was the whole idea of more job-friendly workplaces. When people aren't told in advance what their work schedule is going to be and they have to accommodate childcare or not, it creates problems. So having greater employee-friendly, family-friendly workplaces is the third prong. And the fourth prong is reducing poverty. So again, I think what we just heard, I think, is going to be very important in that regard. But the other three elements actually do deal with economic issues or two of the four. The child care is, of course, when people spend 70% of their net disposable income on child care, that leaves them without enough money for anything else. But in terms of workplaces and in terms of minimum wage and economic opportunities, that's probably a good segue here.
Okay, great. All right. So, thank you. Welcome, Ms. Jackson.
Thank you. My name is Judy Jackson. I live in Berkeley, California. I had to retire at 55 after teaching school for 20-plus years as a special education teacher. I was born with an ear infection in 1945. As a child, I had lots of ear infections from colds, but I grew up and became a teacher. The ear infections became bronchial asthma, and then at 34, I was diagnosed with breast cancer while working at a small private school with no insurance for its employees. So I was forced to spend my retirement money to get the medical treatment I needed. It took 3 years for both the operations and recovery. When I tried to get a job, potential employees always asked about the missing 3 years on my resume. One woman even said to me, "We couldn't hire you. How would we tell the children at our school that someone on the staff was dying?" My doctor speculated that I would be free of the cancer in 5 years. Since my job search in the States was unsuccessful, I found a job teaching the use of computers in American Samoa. When I returned to California, I couldn't teach until I took the CBEST test because I'd been out of the country for more than 3 years. Eventually, I was hired, and when I came up for tenure, they denied it because I couldn't do yard duty without becoming sick. I tried working as a clerk in various temporary jobs, but people in offices come to work sick, and I was vulnerable. I could work when well, but only got paid when I worked. When I got sick, I didn't get paid, and eventually I became homeless. I applied for SSI twice and was denied, and finally I got it because I was so depressed I couldn't even work when I was well. I'm not just asking for SSI for me, I'm asking for an immigrant friend who sleeps in a shelter in Oakland because rent on a studio apartment in Alameda County is 116% of the poverty level. I'm asking for another friend that I tutor who is developmentally disabled. None of us wants a lot of money. We just want to live our lives with dignity. Something needs to be done about it. But we're not alone. More than half of the people on SSI are women. Not a lot of people know that. A lot of women are eligible due to their age and because they don't get Social Security. In fact, the cash assistance program for immigrants, more than 65% of the cases are women, and 90% of them speak English as a second language. Here are a few of my suggestions. We need to restore the cuts to SSI. Our grants lost $77 a month when the state stopped providing cost of living adjustment. None of that has been restored yet. We need to allow SSI recipients to get SNAP benefits. We're one of the only states that continues to bar SSI recipients from getting this help. Many of the people I know run out of food before the end of the month and then have to use emergency services to eat. We should not have to go and stand in a line to eat in a state that has so much money. SSI recipients have little incentive to work. I was recently asked to do a one-time, one-day job for $250 and was reluctant to take it because of the hassle that could cause. SSI only disregards $20 of non-working income and only $65 of income from earnings. This amount has not been changed since 1972. We urge the committee and the legislature to support the federal SSI Restoration Act of 2015 that would restore the original value of the two disregards by increasing them to $112 for any income and $364 for earned income. Recipients on SSI and SSP should have available to them peer support groups similar to those offered in the Living Well program, where other recipients who have encountered problems can give them advice on solutions that work and resources relevant to their problems. When I was first disabled, I was under 65 years old. I applied to the Department of Rehab for training help. I went to the Department of Rehab because I wanted to get a master's degree so that I could teach at the post-secondary level. They looked at me like I was nuts. But I explained that I wanted to be able to teach from home over the internet because I no longer could go out during the winter months. Going out during the winter months aggravated my bronchial asthma. They told me that the type of training they usually gave was below the bachelor's degree, an AA or an AS. Eventually, I was able to convince them to help me for a while. The day I turned 65, they dropped me. I would no longer be eligible for help. I was devastated. My plans were thwarted, to say the least. Why can't they help seniors too? Considering the harsh realities of today's employment market, why are they so reluctant to go beyond community college training? To summarize, recipients of SSI, SSP need to have the cuts restored, get SNAP benefits, and get support from those who are faced with the same problems. They need the limit on the occasional work lifted, and they need the Department of Rehab limitations lifted. How can anyone rise from poverty without support and with so many restrictions? Again, something needs to be done to help us do more for ourselves.
Thank you very much. Thank you for joining us. Kathy, good morning.
Good morning to you, Senator. Thank you so much. I really appreciate the opportunity to be here. I was asked to focus remarks on poverty and equality issues in the foster care system and with the parents and families that we serve. So I'm going to talk about 3 areas today. First is caregivers, especially relative caregivers. The second is the foster children and youth themselves. And then finally, a little bit about the biological parents that we serve and some of the barriers that we face there. First, with respect to our relative caregivers, as I think you both know, we very much seek to place children with relatives whenever possible, and currently 36% of our foster children are placed with relatives. It's the first priority. They tend to be more stable placements and show improvement in child well-being and child behaviors when we are able to find a relative. I looked up some data for this so we could give a bit of a demographic perspective on who these relatives are. Most of them are grandmothers or aunts. 83% of those in a national study that I found, it looked at a cohort over a 10-year period, were either grandparents or aunts. And it's overwhelmingly women overall that are caring for children. 94% of those in the sample were women. As well, they're generally older than other foster caregivers. The relatives, nearly half of them were 45 or older. And there are a number of factors that were measured related to economic security, and the 2 that I wanted to pull out for you are, number 1, kinship caregivers were 3 times less likely to have finished high school than other foster caregivers. 29.2% had not finished high school versus just 9.2% of other foster caregivers. And they were 2.5 times more likely than other foster caregivers to live below the poverty line. That's 33.2% of our relative caregivers in poverty versus 12.9% for other types of foster caregivers. In California, relative caregivers have historically received a lower stipend, or in some cases none at all, for them to care for the children, very low stipends, which was what led to last year the creation of the Approved Relative Caregiver, or ARC program. They've also had a more difficult time accessing services for the children in their care, needing additional support to really figure out how to navigate that system vis-a-vis the other types of foster care providers. We enacted the Kin Gap program to help encourage kin more than 15 years ago to try to take advantage of guardianship, but it wasn't, like I said, until just last year that we enacted the ARC program that will provide increased stipends to our relative caregivers. We're just getting going on that. There is a simplified application for the funding for that, and more than 35 counties have signed up to opt in so far, and more continuing to do so throughout the year. The current discussions in this area that I wanted to highlight are, first, figuring out how to better support, especially the relatives. We've got a proposal in the budget, as you know, it's a $30 million proposal to recruit, retain, and support our caregivers, especially relatives. This would include more specialized training for the needs of the children in their care, as well as child care that could be provided when they need respite. This is an area that both relatives and non-relative foster parents report is a big issue, just as it is for the rest of the state. And also developing peer support networks for foster caregivers, and the ability to provide a pot of funding for special activities that we don't necessarily think of as special, cheerleading camp, participating in football or debate, things that their non-foster care peers are able to participate in high school and junior high, but that require an investment to be able to do that in today's educational environment. There's also discussions about how to further boost that rate that's provided, a proposal from some advocacy organizations to provide a specialized care increment for relatives when children in their care have particularly acute needs, and also thinking about how to quickly start the funding for relatives so they don't have a lag in the funding starting. There's a number of requirements with regards to how we find people eligible and how we approve relative homes that make it complex, and what it really ends up doing is delaying those payments, and it can sometimes be many months before a relative begins to receive those payments, and that's something we'll be working with the Alliance for Children's Rights in particular on with regard to their AB 423. Finally, just thinking about the context for relatives of the continuum of care reform, a discussion that we're having, AB 403 on the Assembly side, Assemblymember Stone's legislation would implement this idea that we need a continuum of care, not just group care, but being able to step children down and support them in as family-like setting as possible. Clearly, relatives are a large part of that. They already represent almost 40%. And so making sure that as we discuss that continuum, that we're truly talking about the entire continuum and how we best support the relatives that are serving the children that we know are struggling with inequality issues and poverty issues is going to be extremely important. Just quickly on the foster children themselves, I know you both know the outcomes for former foster children. They lag, unfortunately, in so many areas behind the children who were not in foster care with regard to housing, education, jobs, and teen parenting. The transition age youth experience is improving in the state. AB 12, enacted in 2010, now allows youth to stay in past age 18 up to 21. And as of January 1st, 2015, there were 9,300 youth aged 18 to 21 in care. The take-up rate for this has been way higher than anticipated, and that's a great success. It does present a challenge, though, both in how we change our social work practice to support these youth, and also how we make sure that they're not falling off a second cliff at the age of 21. We talked for so many years about that cliff at age 18, where all of those challenges around jobs and housing and education really came to bear. We don't want to just push that cliff off 3 years. We want to make those 3 years 3 years that really gives them a chance to get whatever education under their belt, get job history and training under their belt. So when we go to 21, they've got connections with caring adults, they've got community connections, and hopefully a job and education to be able to get over that hurdle and make up those gaps that we've historically seen in the outcomes. As well, I wanted to talk a little bit about the biological families that we serve. Just being poor or being homeless doesn't mean that you're abusive or neglectful, of course. When children are brought in to care, though, and placed in foster care due to substantiated abuse or neglect, job instability, unemployment, and homelessness can become barriers to being able to reunify them with their families. A child has to be returned to a stable home environment. We can't return them to a car or to a homeless shelter. The judges don't go for that. And so there's so many things that we could talk about with regards to the jobs, insecurity, the economic situation, but I want to just focus briefly on the housing component of that. There is some information from the Corporation for Supportive Housing and Housing California that almost half of the children we have in foster care have a parent with a history of homelessness. And there's an estimate that as many as 30% of the children who are currently in foster care could actually be reunified if we were able to take care of that housing situation and instability that their parents face. There's a Bringing Families Home pilot that's proposed as part of the budget by these organizations that we support that would help to develop plans to meet the family's housing needs and help them get into stable housing, either through a rapid housing model or, depending on their service needs, a supported housing model that would allow us to then also be able to reunify them with their children more rapidly. I think 3 bottom lines just to take away. I think we have a pretty good sense of how economic inequality is affecting our families, our caregivers, and our former foster youth and children in care today. I think the broader kinds of issues and policies that were discussed in the first panel, the maximum family grant, SB 23 by Senator Mitchell, the Earned Income Tax Credit, SB 38 by Senator Liu, the minimum wage, SB 3, Senator Leno. All of these things would help our families too, these families that I'm talking about. But there's a series of some smaller investments that I talked about that could be made targeted to these types of families, children, and caregivers that will also go a long way for these smaller groups of individuals to help boost them, both their economic situation and help reduce their housing instability. Thank you so much.